My name is Nicole, and I've been a registered nurse for almost 15 years. In addition to being a registered nurse, I'm also a post-op bariatric patient. One of the reasons I am so excited about this seminar is because it's from a different perspective. There are so many statistics and so much data that kind of surrounds us as a bariatric patient that tells us everything that's going on in our body. But the thing that's missing is the patient perspective. And this seminar is all about the patient's perspective and viewpoint.
22 years ago, I was where you're at now, weighing the pros and cons of weight loss surgery and trying to figure out which path to take. I understand the mix of emotions you might be experiencing right now. I mean, on one hand, the thought of surgery can tap into your fears. It's a big step. With surgery, you're not only changing your anatomy, you're changing your lifestyle, and change can feel scary. On the other hand, there's hope and excitement. Hope that you'll finally put an end to the struggle with your weight. Hope that you'll alleviate the physical health challenges you're experiencing. Hope that you'll be able to do the things that others take for granted. Things like walking a block without huffing and puffing, or bending over to easily tie your shoes. Hope that you can just feel normal. Yep, it's a big decision, and once you decide to go for it, then there are other decisions. What surgery should you choose? Which surgeon is a good fit? When should you do it? And how should you prepare? Fortunately, if you're watching this, you're in a great place to get information to help you make these decisions. I was lucky because it was easier to choose which surgery was right for you back in my day. The sleeve surgery hadn't yet gained in popularity. There was a clear gold standard at the time, and it was the laparoscopic Roux-en-Y gastric bypass. In fact, many still consider it the gold standard today. So based on my personal medical situation, my research, my personal goals, and the recommendation of my surgeon, RNY was the path I chose. And I'm so happy I did. I was back on my feet quickly and returned to work 2 weeks later. There's definitely a discovery period. For me, it was probably about 6 months where you're learning the ropes and figuring out how your new body works. What amazed me was how quickly I experienced results. From the day I had surgery, I was off the meds for acid reflux, high blood pressure, and type 2 diabetes. The weight seemed like it was just melting off. I could move better. I could breathe better. And as the days went by, I felt more and more energized. If I personally had to make the decision which surgery to have today, even with the wider array of options that now exist, I'd choose RNY again without hesitation. It gave me my life back. Here I am 22 years post-op, and the tool that RNY gastric bypass gave me still works. I'm right size with a normal weight and BMI. I'm 5'6", and I comfortably fit into restaurant booths, airplane seats, and size 6 jeans. I can easily enjoy the physical activities that appeal to me, like hiking and biking, and call me odd, but I love climbing stairs too. All things I couldn't comfortably do before surgery. And I'm healthy. High blood pressure, acid reflux, and borderline type 2, gone, gone, gone. No, surgery's not an easy button. You've still got to make wise choices and create a lifestyle that aligns with the tool that surgery gives you. But I'll tell you what, surgery can be a game changer. So listen, only you can decide what's right for you. Do your research, talk to a qualified surgeon who can give you important information to help you figure out which option is best for you. No matter what you decide, I wish you happiness and good health.
Hi, my name is Amy, and I had gastric sleeve surgery in January of 2020. At this point, I am almost 5 years post-op and successfully kept a healthy BMI. And I've been able to do that with a combination of eating low carb and high protein, as well as doing a lot of high intensity interval exercise. Those are the things that I found were the best combination for my specific body. As far as post-op success, I think one of the most important things is honesty with yourself, honesty with your aftercare team, honesty with your support system, whether that's friends and family or a support group or something like that. Because the numbers don't lie. You can say that you're doing all these things, in your follow-up appointments, but if you're not being really honest with yourself, then you're not going to see that success in the long run. I think that it's really important for aftercare to make true lifelong behavioral changes. And so not going into the mindset of, a diet or a phase or something like that, but more so, this is a tool I'm going to use to kickstart those changes that I'm going to make in my life. I'm going to eat healthier, eat more mindfully. I'm going to be active regularly, and all of those things. If you don't build them into your schedule, then you're never going to find time for them. We're all so busy that you can't find time for anything. And so you make time for what's important to you. One of the things that was really beneficial for me was keeping a food and exercise journal. It helped me keep myself accountable as far as what all I was eating. Do I really have the calories left in the day to have that snack, or would it be better not to? As well as it helped me learn how my body responded differently to different types of foods, different types of exercise, and it helped me be more in touch with myself and how my body was changing and adapting to the different things that I tried. And I really think that keeping that food and exercise journal helped me figure out more efficiently what was working for my body. So each person is different. I know so many people who have had the surgery, and of course in the beginning everybody's going to lose weight. You're by nature, you have to. Your stomach is so small. But if they are just maintaining that same type of diet and same level of activity that they were doing before the surgery, that's eventually going to catch back up with you. So if you're not putting those true lifelong healthier behavioral changes in place, this is going to be a temporary experience. Whereas if you really do make a commitment to living healthier, this can be a great jumpstart into a better life, more fulfilling, happier, more active life that, where more things are open to you.
So my name's Chad Riot, and I chose to do weight loss surgery probably about 26, 27 months ago. It was May of 2022 that I did it, May 26th to be precise. It was a really quick process for me. I decided at the end of March, I had an aha moment. I was like, I'm getting the weight loss surgery. I needed a boost, a kickstart to get me going on a journey back to health, sound health. And so I had a consultation with the doctor. And really the surgery I went with is called a SADI, which is a single anastomosis duodenal switch. That's a mouthful. They just call it a SADI. It's a modification of a duodenal switch. So we got everything scheduled. I went in for the surgery on May 26th, like I said. Now, leading up to the surgery, pretty standard with most weight loss surgeries is a pre-surgery diet. I was on mine for 2 weeks, and it was probably the most brutal part of the process, going from an unhealthy lifestyle right into this basically liquid diet for 2 weeks, with the goal being just to shrink, internally some of my organs, my liver, so that the surgery would go smoother, less risk. I lost 26 pounds during that 2-week process, had the surgery. The surgery went as well as it could go. I was in the hospital for a little less than 2 days. They just wanted to make sure I could consume some liquids after the surgery so that I would be okay post-op. I was able to do so without a problem. I had some mild discomfort from the surgery, some pain, nothing incredibly, mind-blowing, uncontrollable. So I was able to leave, like I said, within 2 days. And then really from there is when the real work starts. You follow a strict diet, very directly up to like the next 8 to 12 weeks. You stick to what they're telling you to do. It's broken down into segments, and you gradually start adding, ground food, solid food back in. So, like I said, it's been roughly 26, 27 months almost since I've had the surgery. I've lost roughly 277 to 285 pounds in that range. The surgery, it has gone as well as I could have ever hoped. Like I said, with the amount of weight that I've lost and being able to get my old life back, do things that I was never going to be able to do again, like go to a theme park and ride roller coasters with my nieces and nephews and my cousins, whatever. Something that simple is something that I can now do again. So, for years I put off the weight loss surgery. I would recommend to anybody, if you're contemplating it, don't hesitate. Just do it. It's not the thing that's going to change your life, but the surgery itself will be the major tool to help you make the changes you need to make. And I recommend to anybody that's in need of that little kickstart to just take the leap and do it. So.
Hey, I'm Lee Hanks here in Mobile, Alabama. Just to share a little bit about my story, I had the opportunity to have a Roux-en-Y, a gastric bypass, just over 3 years ago. We chose that route over having the gastric sleeve because I had a history of GERD, and my physician decided that I would have less of an issue or propensity to have an issue with GERD if I did the gastric bypass route. So we chose that. And in May of 21, I was very thankful to have that surgery. And it really, truly has unleashed a new life for me. Coming out of the surgery, I had to, obviously leading up to the surgery, I had to go through a fast leading up to it to prepare for surgery. And it's very manageable. Just follow the plan that they give you, and you will do it just fine. And coming out of the surgery, we had obviously had to ramp back up on the way we eat our food and how we eat it. It started off with a liquid fast and then ramping up into soft foods and ultimately real food. But going right out of that surgery, as the months went by, the weeks and the months went by, and the doctor allowed me to do more exercise and increase intensity with that, I really was able to see the weight come off. There was just, it's just an amazing feeling. Obviously you can visually see it, but internally and emotionally, it really made me feel like a much better person, and glad that I finally dropped my pride and made the step to reclaim my health and take this opportunity that was afforded me. And so now 3.5 years later, everything's just been great. Been able to just do things that I've never been able to do in life, whether it's scuba diving, rappelling, climbing mountains, or hiking some long paths out in the Southwest. It's just been amazing. And if you're wrestling with it, obviously talk with your physician and see what path is best for you. But I'm very thankful, and I'd love to encourage people and share my story.
My name is Narissa Stewart. I had VSG back in July of 2019. I'm also the CEO of Bariatric Society, an organization that provides resources and events to folks who have had bariatric surgery. So one of those things is actually the Bariatric Retreat, an annual 4-day event where we bring in patients, doctors, therapists, and all of your support system in order to provide just an awesome opportunity to connect with others. So as you can imagine, I meet a lot of bariatric patients. So I am often surprised by some of the things that, that happen after bariatric surgery, right? So a few of them are, one, fertility. I don't think that people often realize that your fertility can soar after bariatric surgery. I'm a witness of that. I ended up having a surprise bariatric baby in 2021. So I got pregnant 18 months after surgery. I would also say another thing that people are surprised about are the hunger cues, or the fullness cues rather, where you might have a runny nose or sneezing or hiccups. I never put that together before or having bariatric surgery. I think another thing that people are often surprised about is the fact that this community is so engaged, and folks want to have that desire to connect with others that are going through the journey or have gone through the journey. I would say another one is that you can truly find an NSV, or non-scale victory, in anything, from riding a roller coaster to being on an airplane and not needing a seatbelt extender to being able to sit cross-legged. There are so many things that you may not realize that you're able to do after surgery that maybe you weren't able to do before. I think the last thing is that your body can truly do anything. I think that you can challenge yourself to do things that maybe you wouldn't have challenged yourself to do in the past, like running or bodybuilding or jumping rope or doing, things that you never thought you could. The body is amazing, and the body will continue to challenge itself over and over and over again. And then, I think the very last thing is that you can eat again. So even if you are a lover of food, a foodie like myself, you can still enjoy those things that you like, especially if you do that with balance and moderation.
While bariatric surgery is very safe, and is actually as safe as gallbladder surgery, there's always going to be a little bit of a risk, just like any other procedure. The immediate complications that can happen within the first 30 days of the procedure are leak. This does not happen often. It happens in about 1% of the patients. Bleeding also happens in about 1% of the patients. Damage to adjacent organs. Of course, we take good care not to injure anything when we do those procedures. And of course, bowel obstructions. And those can happen about 1% of the patients as well. Blood clots can also happen, and that's why it's important to stay hydrated and move around. Long term, after 30 days, this is procedure specific, but those entail bowel obstructions and those entail reflux and heartburn, depending on your procedure too, and also entail malnutrition and malabsorption, especially if you're not taking your vitamins. If you develop any of the symptoms that are fever, difficulty breathing, or of course pain that is very different from the pain that you've had right after the surgery, and nausea and vomiting that do not really stop, you have to let your surgeon know immediately because you might be suffering from one of those complications.
Thank you so much for watching. I hope that you found this to be impactful, informative, and relatable. If you are on your journey and if you're trying to figure out what your journey looks like, I wish you the most success on your weight loss transition, and I hope that you have great outcomes.